Hello everyone, I'm Martin Padilla and welcome to a special edition of Fact Friday. On this edition of Fact Friday, we're going to be talking about the COVID-19 vaccination program. And here to tell us more is Dr. Hector Ocaranza, City County of El Paso Health Authority. Dr. Hector Ocaranza, thank you so much for joining us. Now, we're currently in Phase 1, Group A and Group B. Can you tell us what is Phase 1 and who is part of Group A and Group B?
Well, the Phase 1 of the vaccine includes right now two groups. Group 1A, which includes all the healthcare workers, initially starting with the people that take care of the sickest COVID patients, which are the nurses that take care of the patients inside of the hospital, physicians, respiratory therapists, and all those healthcare workers that are going to be inside of the hospital. Then we continue immunizing those that are healthcare workers as well that work outside of the hospital, along with also first responders, meaning the first responders that are in contact with patients that potentially be infected with COVID-19, which is the people that are handling the emergencies, emergency medical services, those ambulances, paramedics, emergency medical technicians, etc. Some of the other first responders as well, they're going to be receiving that vaccine in the first group. And also, going down the list, the school nurses are also in that kind of category. That is the Group 1A. The Group 1B includes other people that are at risk of developing complications from COVID-19, whether they get infected. And those include people that are 65 years of age and older, and anybody who is older than 16 years of age with underlying medical conditions, which also, again, might pose a risk for them to develop complications or pass away if they get infected with the COVID-19. Those are the two categories of people that we're immunizing right now. And it is important to know that it is a slow process, so please be patient.
Why are these residents the first to receive the vaccine?
These residents are the first to receive the vaccine because, one, they are in very close contact with patients with COVID-19, and we need to keep our healthcare system up and running. We need those healthcare workers to provide the service that we need for those that are affected the most, especially the ones that end up requiring hospitalization or required to attend to an emergencies. And then also the other group is the one that could develop complications from COVID-19 and end up in the hospital, because we don't want to overwhelm our hospitals with a large number of people.
Who should consider getting the vaccine?
Well, everybody should consider getting the vaccine, although we need to go by groups, and those groups are determined by the risk of developing severe infection, and that's why we invite people that belong to any of these groups to get immunized, but eventually we want everybody to be immunized against the COVID-19 so we all stay healthy.
How can residents pre-register for the COVID-19 vaccine?
The way the residents can pre-register for the vaccine is by logging on to the website epstrong.org and click on the tab about vaccination or pre-registration on the vaccine. That's the page that you're going to be entering your phone, your date of birth, your full name, and the category that you belong to. They're going to ask you if you are a healthcare worker. They're going to ask you whether you have any medical conditions or if you're older than 65.
Once the resident is pre-registered, what happens next?
Well, once a resident pre-registers, we keep the name in the list. And as we immunize people, we're going down the list, calling people, giving them appointments so they can come and receive their immunization. So the name is never scratched off unless they tell us that they received the immunization somewhere else. And even if they don't answer when we call to give an appointment, we're going to continue insisting, we're going to continue calling them when we have the vaccine available.
How safe is it to get the vaccine? Are there any side effects?
The vaccine has been proven to be very safe. It's already being tested because the concern is for a lot of the people that the vaccine hasn't been tested enough, but it has. There's been thousands of people that have received the vaccine in the trial phases, and thousands of people have received it now. It is very safe. There is a possibility of very severe allergic reaction in some individuals, but it's not common at all. The most common effects of the vaccine is that it's going to be hurting where you receive the vaccine, and at the moment of the second vaccine, you might get some body aches, some low-grade fever, headaches, but that is about it, and you should get better within a day or two.
If you are called to get the vaccine, can someone else go with you, or should only the person who will receive the vaccine be in the vehicle?
Well, only the person that has the appointment is going to receive the vaccine, but if you need help in any way, you can bring that person to help you to receive the vaccine. Unfortunately, only the people that have the appointment are going to be receiving the vaccine, and that's important to mention.
What can we expect in the coming weeks?
We're going to be expecting to receive more vaccine from the state, and as we receive more vaccine, we're going to be immunizing more people. So little by little, we're getting through the list, immunizing those that are qualifying under those groups that we have mentioned before that pose a risk, and we're going to continue providing the vaccine.
When will other phases be added?
As we move forward with the phases that we have now, and we see that we have immunized a large number of those people that belong to those groups, then we might move to the next phase, in which is going to be opening for more people to receive the vaccine. So it's still going to take some time before we go through these groups right now that we're immunizing, and it's because we have a very limited amount of the vaccine. One thing is that we still haven't approved the vaccine to be received by children younger than 16 years of age. So those are not going to be receiving the vaccine anytime soon, but we'll let people know as this changes.
Is there anything else you'd like to add?
Please be patient. That is the most important thing. The process is slow, but it will get done, and with the help of the community, we will continue immunizing those that are considered at risk, and we will continue moving forward as we receive the vaccine from the state.
Well, that does it on this edition of Fact Friday. Dr. Hector Ocaranza, thank you so much for joining us, and thank you all for watching. Remember, if you need any more information on the COVID-19 vaccination program or on anything COVID-19 related, make sure to visit epstrong.org or the city social media pages. We'll see you guys in the next Fact Friday.